Welcome back. On this program, we have spoken quite a bit about the heroin epidemic that has impacted our area and the entire country. It does not pick favorites between red and blue states, and literally every socioeconomic group, as we know, has been devastated. Now the fight against addiction could even get harder if and when Obamacare is repealed. New Jersey in particular is one of those states that will be hit hard since it opted for Medicaid expansion. It could be dealt a major blow, especially in this area. A recent op-ed in the Star-Ledger explains what's going on. Quote, changes in this system would have devastating impacts on mental health and substance abuse services throughout the entire country. Any cuts to the Medicaid expansion on the federal level would take even more resources from the behavioral health safety net, a chilling prospect given the current opioid and heroin crisis that the country faces. Well, Robert Budsock, he wrote that piece. He's also president and CEO of Integrity House, one of the largest nonprofit providers of substance abuse treatment in New Jersey. He's kind enough to give us a few minutes. Robert, let's give the audience a little background on Integrity House and also put a human face on this. Talk about the people walking through the doors and some of the treatment they receive.
Well, our mission at Integrity House is to provide opportunities for individuals to rebuild their lives. Early last year, in 2016, Governor Christie proposed adding an additional $127 million into the New Jersey state budget to ensure that we had a robust mental health and addiction treatment system in the state of New Jersey. And what we've experienced as a result of that are that many more individuals are getting the opportunities to put their lives back together at Integrity House through the Medicaid expansion. The example that I would like to give is that where we had individuals that were not covered by Medicaid prior to the expansion, they were left to basically fend for themselves and utilize emergency room services for their medical problems. What happens now is that we have individuals that come with us that have Medicaid as their coverage. That coverage sees to it that they receive the services they need for their addiction problem. Many of these individuals also have co-occurring mental health disorders. The Medicaid coverage ensures that they receive the services from the psychiatrist and that they receive the appropriate medications that they need to treat that psychiatric disorder. Once the individual receives the appropriate addiction treatment, mental health treatment, and the primary health care and the disease management, that they are able to get back into our workforce and thrive.
For those, in the throes of addiction, either if they're not getting the right treatment, they're going to turn to crime, and I should say, a lot of them probably going to end up dead, right?
If addiction is untreated, that the reality is that the individual is going to many times end up in institutions, in jails, and many times death. And we could prevent that by maintaining the essential benefits and by maintaining the Medicaid coverage for individuals that are most needy. And the other thing that's really important is that these individuals that are very needy, you're not going to see them coming together and advocating for themselves.
Robert, thank you very much, and I wish you guys the best of luck here. I know you do great work here, and it's critical work at that. Again, that's Robert Budsock from Integrity House. Thank you.
Thank you, Richard.
All right, everyone, coming up next, we'll take a look at some local headlines, so please stay with us.